Gavin, and my pronouns are she, her. I am the ED of the Well Community Collective, and I am a public engagement and health policy project community fellow at McMaster University. Our project, Rural Integrated Youth Health Service Engagement Initiative, was developed to increase multi-sectoral engagement, school boards, health units, and youth serving clubs, to improve youth and community engagement and co-design strategies, facilitate engagement opportunities, and to begin evaluating our engagement. Overall, this fellowship has helped us to ground our engagement sessions in a more socially equitable manner as we work with rural youth and families with lived and living expertise to co-design IYS networks or integrated youth service networks with safer spaces utilizing evidence-based engagement practices and evaluation. To be honest, this engagement project has really taken on a life of its own. Initially, we were focused on holding in-person engagement events to increase collaboration and understanding of integrated youth service pathways. However, as we were feeling more confident and able to engage youth, families, and community members, we decided to add in the evaluation piece. And currently, the fellowship has allowed us to support all of our youth, families, and community members with an honorarium for each bi-monthly and monthly meeting they attend. And in addition, our youth engagement leads have been able to dive into evaluating how well we're actually engaging folks across our 4 counties. This fellowship has really allowed us to zero in on defining our engagement practices. We had a good understanding of youth and family engagement. However, with this fellowship, we were able to really hone our skills. We finalized our rural youth, family, and community engagement best practice document, finalized our engagement and safer space and honorarium policies, and we are beginning to evaluate and assess our engagement practices across our Youth Action Council, our Family and Community Advisory, and with our community stakeholders. Using the PEHP, or the Public and Patient Engagement Tool, we are collecting a fulsome understanding of our engagement strategies and able to refine our processes as needed. In our rural area, I think this project has really changed the way folks see public engagement in the mental health and substance areas. Our continued focus on nothing about youth without youth has attracted some attention. Folks in organizations sometimes don't see the importance, or they haven't fully invested in youth and family engagement. And as such, they don't yet see that youth and families that are actually experts in youth mental health service delivery and design. But thanks to this fellowship, we have youth and families included in all of our work, literally all of our work, from designing youth hubs, creating engagement documents, developing process maps for intake, and sharing their voices beside CEOs at our governance tables. It is inspiring to see youth working as community leaders at these tables, seeing their confidence increase as their voices are heard, and they have the opportunity to be involved at such a deep co-design level. We were really inspired to apply for this fellowship when we first saw it. 6 years ago, as a seedling organization still forming in my head, I did lots of research around youth friendliness, engaging youth and families authentically and appropriately. Most of my research at the time came from Origin at the University of Melbourne. And since then, the Knowledge Institute has come out with engagement standards for youth and family. But for a while, no one in our rural areas seemed to be talking about how folks were engaging youth and families beyond tokenism. So needless to say, this fellowship for us was a complete win-win as we were able to continue learning more about engagement and evaluation and support and expand our 4-county engagement for youth, families, and communities.